It's been a week since the world watched in horror as Buffalo Bills defensive back Damar Hamlin suffered a sudden cardiac arrest and collapsed during a game. Hamlin cheered on his team against the New England Patriots from his hospital bed, tweeting game time with a photo of himself sitting up. His condition still critical, but he has made amazing progress. Across the NFL, players wore the same shirt pregame with the message, "Love for Damar." The incident raising questions about why sudden cardiac death happens and is a reminder to all of us that every second counts when it does. Dr. Nidhi Kumar is on call this morning with life-saving information. Thank you so much, Doctor, for being with us.
Good morning.
And it really is such a question, and many people are asking, what is sudden cardiac arrest as opposed to a heart attack? I mean, what are we talking about the difference here?
Yeah, so sudden cardiac death results from an electrical disturbance in the heart, which prevents the heart from pumping blood to the rest of the body. Now, this is different than a heart attack, which occurs when a blockage forms in a vessel that supplies blood to the heart. Now, a heart attack can result in a sudden cardiac death. And what we saw happen to Damar Hamlin happens 1,000 times a day in the United States.
Really?
Yeah.
Isn't that remarkable?
Yeah.
So what causes a sudden cardiac death?
So sudden cardiac death can be caused by structural issues with the heart. These can be inherited or acquired. This is one of our biggest concerns with COVID, causing myocarditis, which can cause structural changes in the heart and predispose patients to these types of issues. Then there's arrhythmias. Again, can be inherited arrhythmia syndromes or can result from drugs, electrolyte abnormalities, or what they're hypothesizing with Mr. Hamlin, trauma to the chest. And then finally, coronary artery disease. A heart attack can cause a sudden cardiac death.
So who's at risk? Is there a way to screen? And are we concerned about younger athletes here?
So anyone who has a history of cardiovascular disease or family history of sudden cardiac death is at risk. We don't screen the general population. A lot of the tests, EKGs, echocardiograms, may not show an abnormality. Now, in terms of athletes, younger athletes under the age of 65 are screened with a thorough history and physical exam.
So under the age of
35.
Yeah.
Older athletes, we say over the age of 40, we call them our masters athletes. They're screened based on risk factors with an EKG or a stress test. And any athlete over the age of 65 gets a stress test.
Okay, so how do you treat the condition? And tell us also what you brought along here with you.
So 911 and initiate CPR. Good chest compressions are as effective as chest compressions with rescue breaths. So we don't want people to hesitate doing chest compressions or CPR. But the definitive treatment is really with defibrillation with an AED. Deploying a shock to the chest will reset the heart rhythm. Every minute that goes by without defibrillation, mortality increased 10%. And then finally, for patients that survive out-of-hospital cardiac arrest, many of them undergo a procedure called therapeutic hypothermia, where we drop the patient's body temperature to 34 to 36 degrees Celsius. This protects the brain, and it provides better neurologic outcomes for patients. And so the life-saving device is the AED, and you can see that this small device, it is only 6 pounds, is really the game changer.
More and more at different arenas, even in high schools. I mean, on fields, you're seeing that a lot of people are now bringing this along, at least have it close by. Any team, any game, any practice.
Absolutely. Every field, every sideline, every stadium, every public place should have an AED, because what we saw last week is this was the real game changer. You don't need any training. It talks to you. It tells you what to do.
Stay calm.
So stay calm.
Instructions.
And so it walks you through
911 is called
all of the steps of what you need to do. You
Begin by exposing patient's bare chest. Remove or cut clothing if needed.
So the AED will also read the patient's rhythm and deploy a shock if necessary. And it'll also tell you to get out of the way so you don't shock yourself. And then secondly, you know, anyone and everyone should really be trained in CPR, because the more of us that know CPR, the better the survival when things like this happen.
When it comes to the pro athlete, Damar Hamlin, what do you see as his prognosis?
Well, Damar Hamlin trained his entire life to be an elite athlete, but he also trained his entire life to survive that moment. He had excellent cardiopulmonary health. He had millions of people praying for him, and he got good quality CPR, and he got defibrillated early. So I think his prognosis is going to be excellent.
All right, Dr. Nidhi Kumar, thank you so much for being with us. We really appreciate it. Such great information. We'll be right back on CBS News New York. Stay with us.